All right. Good evening, everyone. My name is Rob Hatton. I'm the communications manager with Grey County. Thank you, everyone, for joining us on the family call update again tonight. I know I haven't been on one of these in a while, and it has been a little bit since we hosted our last one. So it is nice to see everyone joining us again tonight. Also on the call tonight is Denna Leach. She is our clinical specialist for long-term care at Grey County. And taking the lead tonight will be Jennifer Cornell. She is our Director of Long-Term Care. And before I do pass the floor over to Jen, I just have a couple of quick housekeeping items that I wanted to go over quickly here. So first off, I do just want to note that this call specifically tonight is for Tuesday, November 9th, 2021. And this video discusses matters related to residents of long-term care homes operated by Grey County during the COVID-19 pandemic. By all means, feel free to use this video and share it with others in the Grey County community. And if we do have anyone on the call tonight that has a family member in a long-term care home that isn't operated by Grey County, you can please contact that home directly if you have any questions or concerns about the care of your family member in those homes. The format for tonight's call will be the same as we usually do. We'll open it up with an introduction from Jennifer, and she will provide an update about what's going on corporately across the homes. Following Jennifer's update, we will get to as many questions as we can from you on the call. We do ask that you submit your questions using the chat feature, which you will see on the bottom of your screen or on a location on your device if you're on a tablet or a handheld device. And this just helps us track the questions to make sure that we don't miss any, as we know we usually do have quite a few coming in, and that way we make sure that we get to everything that needs to be done. And Jen, did I see you raising your hand?
Yeah, I just wondered, do you want people to use the chat or the Q&A?
Sorry, the Q&A feature, yes. The Q&A is the one for tracking. And the chat, you can post in there, but we really do want you to use the Q&A for tracking purposes, as the chat does kind of get away from us and we can't mark the questions as answered. So with that, Jen, I will pass it over to you.
Great, thanks, Rob. All right, I'll just bring my notes in front of me. So good evening, everyone. Thank you so much for joining us tonight. Rob did the introduction, so I'll just get started. We met last virtually on July 22nd, 2021. We then held a virtual special event in August to celebrate the 1-year mark of the DCP program. And now here we are in November already. I can hardly believe that much time has gone by. Over the past number of weeks, there have been further directives and updates from the province, the Ministry of Long-Term Care, and Public Health. As of today, there are no long-term care homes in outbreak in Grey Bruce. The purpose of our call tonight is to provide an update on the changes released by the Ministry of Long-Term Care. I'm going to give just a quick overview of the strategies that continue to be in place in the homes. Active screening continues for every person who comes in and out of the building. This includes every team member, every service provider, and every visitor, essential visitors and indoor visitors. This active screening includes documenting name and contact information, answering the specific question, and some on-the-spot education on PPE use. Rapid antigen testing continues for any unvaccinated or partially vaccinated staff, visitors, and designated care partners, and we'll talk about that just a little bit more later on. All staff and visitors in the home are wearing surgical masks at all times. Plans are in place in all 3 homes to quickly isolate residents if needed, and plans are in place to quickly move into full outbreak protocols if needed. And we continue to monitor our PPE supply, and we report that inventory to the province regularly. So I'll just get right to the update around vaccination. So on October 1st, the Ministry of Long-Term Care mandated that all staff, students, and volunteers in long-term care be fully vaccinated by November 15th. This mandate does not apply to DCPs and visitors. There is a concern in Ontario and in the community about the impact of this mandate on staffing levels, and I can provide reassurance that our staffing complement is not significantly impacted. To date, 97% of staff have complied with the mandate and are fully vaccinated. A small number, approximately 30 staff, and this is across the 3 care communities, which is in total just over 550 team members. So a small number, approximately 30 staff, have recently had their first dose of vaccine and are in the waiting period between first and second dose. This leaves 3%, which is fewer than 20 individuals who have chosen not to be vaccinated or are still undecided. We continue to offer education and information and on-site vaccination to support these individuals. If, however, they ultimately choose not to be vaccinated, they will no longer be employees of Grey County Long-Term Care. Booster clinics and third doses. Third doses of vaccine have been available to residents in long-term care, and over 240 residents have received this additional dose of vaccination. On November 3rd, the Chief Medical Officer of Health announced the new rollout for boosters, and as of November 6th, boosters are being made available to additional groups of high-risk individuals if at least 6 months have passed since their second dose. The booster is recommended to these groups to provide an extra layer of protection. So who are these groups? It's individuals age 70 and over, so born in 1951 or earlier, healthcare workers and designated essential caregivers in congregate settings, including long-term care homes and retirement homes. And then just for interest's sake, this might apply to some of you, individuals who received a complete series of AstraZeneca or 1 dose of the, it says Janssen vaccine. I don't know if that's the Johnson & Johnson vaccine. So at this point, we have no indication that boosters will be mandatory. However, we are making every effort to inform, encourage, and provide opportunities for staff, DCPs, to receive the booster shot. Watch your email for details on booster clinics from your home. We will be running clinics similar to the first and second doses of vaccination. So watch your emails for more details on that. Influenza vaccine. Clinics were held in October for residents, and November clinics are scheduled for staff and designated care partners. And that's for influenza vaccine. And in some cases, you'll be able to get your influenza vaccine and your COVID booster at the same clinic. Surveillance testing. Rapid testing for unvaccinated visitors and DCPs continues 2 to 3 times a week. Random rapid testing for fully vaccinated staff, students, and volunteers have been in place since October 15th. This randomized testing must be weekly. It must be random, so it can't be always the same day, same time. Must be conducted on different shifts, include staff, designated care partners, student placements, and volunteers. So every once in a while, when you're coming in for a visit, you may be told that today's the day for random testing, and you may be required to do a random rapid test. Ipac strategies and influenza season preparation. There's been lots of work happening over the past weeks to prepare for influenza season and any further waves of COVID-19. Dena and the clinical leaders have worked through tabletop exercises to practice various infection control scenarios. The Ministry of Long-Term Care provided a fall checklist, which is an audit tool that helps us identify gaps and opportunities. And all 3 homes have an infection prevention and control lead, and many of those leads are in the process of getting enhanced education and credentials specific to Ipac. Ministry of Long-Term Care funding announcements. There have been lots of announcements on all sorts of things from the province over the last couple of weeks, talking to increased funding for direct care hours, allied health funding, and education and training funding. So on October 6th, the ministry made an announcement about funding, and a follow-up memo was received on October 15th that outlines the ministry's investment in long-term care. So up to $227 million in base funding this fiscal year to increase the average hours of direct care provided by registered nurses, registered practical nurses, and personal support workers. which will increase the daily average of 2 hours and 45 minutes per resident per day, and that's based on 2018 data, to an average of 3 hours per day by March of 2022. Another investment of $42 million in base funding this fiscal year for allied healthcare professionals, and that might include physiotherapy, social worker, recreation, to improve the current daily average of 30 minutes to 33 minutes per day. A $10 million annual base funding to support education and training of long-term care staff, supporting professional growth fund. And then the government has further committed an investment of $673 million, $1.25 billion, and $1.8 billion for staffing increases between 2022 and 2025. We are working right now in putting together our proposed budgets to be presented to the Long-Term Care Committee of Management and then presented to County Council. And the budgets and the budget reports will include details of how this funds are being applied in each of the 3 homes. And you can watch for information on that. It's all public information, and happy to share it. Improved inspection programming and new legislation. So those are other announcements that have just come kind of bundled with that funding announcement. So if passed, what's the words that the ministry is using is the Fixing Long-Term Care Act 2021. It would make several changes. It would establish this commitment to provide an average of 4 hours of daily direct care per resident by March of 2025. And we welcome this commitment and additional funding to support an improved experience for each of our residents. We do still have concerns about access to health human resources, but we are actively working with our partners in the province and our partners in the sector to attract skilled staff. This proposed change to the legislation would strengthen the Resident Bill of Rights to align with Ontario Human Rights Code and recognize the role of caregivers in residents' health and well-being. And I don't have to tell you, all of you were leaders in this and really made this happen. And Grey County Long-Term Care we've worked really hard to acknowledge the important role of caregivers with our designated care partner program and our Color It Your Way philosophy of care. And so we welcome these changes to really formalize that. The legislation, if passed, would implement new requirements for an annual resident, family, and caregiver survey. And we have a well-established survey program. I'm going to mention it. Actually, I'm going to mention it right now. I'd like you to watch your emails for our annual family satisfaction survey. Your feedback and recommendations are important to us in ensuring ongoing improvement. Staff are working on meeting with residents to complete the resident satisfaction survey. And so again, we welcome these changes to improve the tools or opportunities for us to learn from others. And finally, the highlight of this new legislation would also look to establish new compliance and enforcement tools, including doubling the fines on the conviction of an offense under the proposed legislation. So our priority is to continually improve the environment in our homes and our residents' experience. We hope that through these new tools, we can continue to work with the province to make our homes even better. So that is a very quick summary of the announcements that have come out over the last couple of weeks, really highlighting this government's commitment to improving the resident experience. Last couple of highlights. Booking space for holiday gatherings. The Christmas and holiday season is just around the corner. So each home will have some space available for residents, families to book to support your holiday gatherings. The room capacity will vary from home to home. If you are planning to share food and drinks, we will require that guests must be fully vaccinated. Contact the RFSM, so the Resident Family Services Manager, Kim, Andy, or Terry for the respective homes for details and support with making those arrangements. Christmas and holiday events. Each home is busy working on plans for the upcoming holiday season. Activities will include visits from Santa with photo ops, holiday decorating activities, entertainment, Christmas market for residents, cookie decorating, a Christmas cart parade, which sounds really interesting. I want to know more about that. So watch for information and updates in the newsletter and around the homes for what's happening to celebrate the holiday season and what opportunities there are for you to be involved. A couple of gentle reminders: hand hygiene, hand hygiene, hand hygiene. So I was joking that if we don't feel like we've bathed in alcohol hand sanitizer, we haven't used enough. So just a reminder, everyone's great to use the hand sanitizers when you come in and go out of the building. Also, there are dispensers all around the home. Use it in and out of residents' rooms. If you touch the elevator, use it again. So it just can't be used enough. A reminder that we still need to leave our masks on when we're in visiting our residents, in visiting the home. There are other things going around as well as COVID. Two of the homes have had a respiratory outbreak, rhinovirus, which is the common cold. So there is still lots of stuff going around, and mask use really helps limit that. And remember to check in advance with staff when you and residents are going out so that medications and other arrangements can be made ahead of time. And that is a ton of information. Thank you for your patience, and we will get to your questions now.
Thank you for that, Jennifer. And we do have our first question there, but before we get to that, I will just remind everyone that if you have a question, please don't be shy, put it in the Q&A function, and we will get to those. Our first question is from Vic, and he asks, do you know approximately how many staff may not get vaccinated?
Sure, and at this point, it's looking like around 19 staff across the 3 homes. So out of 560-ish are either have already decided that they are not or are still undecided. And the deadline of November 15th is coming quickly.
Thank you. So at this point in time, are unvaccinated staff still on duty?
They are, with the requirement of rapid testing 3 times a week.
Thank you. And the rapid testing, this is different than that random staff testing, is that correct?
That's correct. So we will continue with the 2 to 3 times a week of rapid testing until November 15th. And then after that, rapid testing will be used for any designated care partners or visitors who are not vaccinated or are partially vaccinated. And then this random testing of fully vaccinated people just as another layer of protection. And that's part of the directive from the Ministry of Long-Term Care.
Great, thank you. And sorry, Jen, and the date staff would be terminated if they are unvaccinated?
Is 2 weeks. So after November 15th, if they're unvaccinated, they will be off work on suspension for 2 weeks. And then if they still have not made a change in that status, then they would be terminated.
Thank you. Are unvaccinated visitors tested each time they visit?
Dana, can you help me with that?
Sorry, I'll unmute. And so each time that our unvaccinated visitors that are unvaccinated come, not only are they assessed with a detailed screening tool which reviews all of those symptoms, but also they will be asked, would they have been swabbed previously? So it may not be every day. So if they come in, it's every other day.
Okay, thank you. This question, when I visit my resident and bring food in, may I remove my mask and eat with her? What about visitors that bring coffee, etc.? May they drink with the resident?
Yeah, so I'm going to look to Denna just to be sure, but as long as both individuals, the resident and the visitor, are fully vaccinated, then you may eat together in the resident's room. Is that correct, Denna?
A little bit. What we're certainly trying to discourage, and what we want, the fully vaccinated for sure. So we definitely want to ensure if you're sharing a meal, and we want to get back to that sense of community. We want to color it for community, but we also want to color it for quality and safety. So along with that, hand hygiene and having a coffee, it would be different than just having a drink, but we want to discourage, sipping continuously on a coffee for a 2-hour visit. So I just want to, there's been some of those challenges because what we want to do is when you're not actively eating or drinking, the mask goes back up. So does that make sense? So when I say sort of, but it also in between, it's hand hygiene, and when not eating or drinking, mask go back up.
I think that's great, Denna. Children who are not old enough to be vaccinated yet, can they visit the home and attend a holiday gathering within the home?
They can, and I'm going to defer to Denna on the details of this one too.
I think these are the things that we're really looking at. We are seeing an increase in respiratory illnesses with young people, the inability to be vaccinated. I would encourage the families who are wanting to bring young children to have a discussion with the RFSM so we can take a look at how we can make that happen. But I also, we're looking at the guidance from the province that says when you share a meal, you must be fully vaccinated. So there may be an opportunity to bring the children in, but we'll just may not be able to work around that particular part of it. So I know we can get there. We just maybe have to do a bit more conversation. But again, the guidance document says only in terms of sharing a meal in the care community must be fully vaccinated. The individuals must be fully vaccinated.
Great. So they can come to party, just maybe not be part of the buffet, the food. Okay.
Thank you. These next two are similar. They're regarding visitor vaccination. And the question is, why are visitors not subject to being fully vaccinated? Do we see that as a potential risk to bringing COVID into the home? And then the other comment does just make a point of the hospital having a policy around visitor vaccination. I think that was a story in the papers this week.
Yeah, no, I agree. It is anybody coming in and out of the home is a potential risk of bringing in lots of things. Being unvaccinated does increase the risk. The ministry directive is really clear that visitors that are unvaccinated are not to be excluded. So we need to find a way to support unvaccinated people from visiting. And so we have the rapid test that helps support that. So unless that changes, that's the guidance that we're required to follow.
Do we have a plan in place if we lose 19 people due to this vaccine mandate? How will we ensure that there will be no disruption to the standard of care that our residents are receiving?
Yeah, it's a great question, Tanya. So yes, we have lots of plans and strategies. They may not all work. And with the current staffing challenges just across the whole sector and that we were really beginning to experience before the pandemic, the risk is a disruption to the standard of care. So it's something that we have spent a lot of time working on and strategizing around. So we do have our staffing partners. We work with Plan A, that's an agency, and we've worked with them for a number of years. I want to say maybe 5, depending on the home. And so we have been working with them. They are also struggling to increase their pool of staffing available. And so we're looking at creative ways to increase increase number of shifts that some of our staffing partners who are already part of our teams they're working more shifts, looking at creative staff scheduling within our own pools, are there opportunities there? And fortunately, 19 people, it's 19 people and it does have an impact, but 19 across the 560-ish that provide the care really is a smaller number. It's really more manageable, and I'm so grateful for the 97% of the team members that have complied with the directive and made this much less of a crisis that we could be facing.
Thank you. Okay, just quickly a point of clarification on children visiting the homes. Can children visit in a room and then with no masks on during a regular visit? So this is unrelated to Christmas.
Everyone should have their masks on. If
Yeah,
they're with masks.
With masks, but unvaccinated because
Yeah.
they're not of age.
Yes, and there is, depending on the age of the child, rapid tests have been used very successfully. As young as 2 or 3, and we've had lots of visitors that are 2 or 3 and older over the past number of months since rapid tests have been available, and it really is not invasive, that test, and it's worked really well.
Thank you. Okay, did you say that both the flu shot and third dose of vaccine will be given at the same time at a clinic at our long-term care home?
We are looking at that as an option, and it may be different depending on the home. So just watch for those details. If we're able to combine it, we will. We are working with the clinical team and our medical directors to make sure we have all the right I's and T's dotted and crossed to make sure that we're able to do that. So keep an eye for that. NACI has confirmed that people can have the influenza vaccine and a COVID third dose or booster at the same time.
Thank you. If we have a special event like a birthday or anniversary, can we book the auditorium or a room to have a family visit? If so, how many people can eat in the room with guests? Cake, thinking all must be vaccinated.
Yes, if you're going to eat together, then all must be vaccinated. I do think that Terry or Karen sent me an email with some details about the space, the capacity of the auditorium. Oh, look at that. So my phone a friend has already responded. So Terry is saying that at Rockwood in the auditorium, the capacity of that space is 20. So to sort out all the details, just connect with Terry at Rockwood. I'm assuming it's Rockwood because it's the auditorium. Connect with Terry and she'll work through with you all the details. And just share what your request is, because there'll be lots of things that we can do and some that we can't, but we can help find an alternative.
Perfect. Thank you. Jen, you've mentioned the overall statistics for staff vaccination rates and all of that, and 19 staff remain unvaccinated or undisclosed. Do we have a breakdown of that by home available tonight? I'm not sure if that's something you had.
We do. I worry about the small number starting to be identifiable. So we still have requirements in terms of protecting staff health information and their private information. But I don't know. Rob, do you want to weigh in on that?
Sure. I don't have the information itself, but I guess probably the question is this all grouped to one home where it might
Okay.
begin to cause
No, and I think that, so it's out of the 19, it's about 8 at one home, 1 to 2 at another, and then wherever are we, what, about 7 to make it add up to 19. So it's that's how it's divided. And if you are interested in more specific details, maybe connect with me offline, and I can then have a better sense of your concern and your question so that I can respond in a way that doesn't also put at risk the violating or breaching identifiable and health information of the team members.
Sure, I think that's fair, Jen. And a really easy way for anyone that does have a question, or if you want to ask a further question after this call, an easy way to get a hold of us is just to reply to those email blasts that we send out. Those will come to myself or my team, and we can point them in the right direction for you. How many people, DCPs or non-DCPs, can attend a general visit in a resident's room?
That is a really great question that I don't remember the answer to.
Yeah, I think in terms of when people are visiting, there's a couple of variables we have to think about. Are they in a private room? Are they, do they have, what else is going on in that particular unit? We have accommodated a lot of various requests, in terms of children coming into a home or into the resident's room with a particular family member, and we work with the RFSM, the resident family services manager, to accommodate some of those unique challenges. Other homes have a designated area to support. So there's a couple of different considerations, but in general, we're trying not to limit visitors with DCPs or general visitors, but there will be some, do we need to do a window visit? Are we accommodating others? So it really depends. There's a lot of avenues, and certainly we want the residents to have visitors and company in a way that supports not only them, but roommates and the rest of the residents in the care community.
Great, thanks, Dana. If it sounds like there's a wild party going on and there's more than there's only standing room only or something in the room, we might suggest an alternate suggestion to make sure we can distance. But yeah, thanks, Dana, for that.
Yeah, and this nice weather certainly has made a lot of people want to go outside and visit. So again, there's less restrictions there for sure.
Hey, so with the mandate being lifted last week by Doug Ford for healthcare workers not being enforced, was that discussed with management to not terminate employees? And if not, was it a situation of government leaving it too late to cancel? So I think there's maybe a couple things here to break down, Jen, and that's the difference between what the government announced regarding healthcare versus long-term care.
Yeah, thanks, Robin. It's a great question, Diane, and there has been lots of or a little confusion about that. So the directive from the Ministry of Long-Term Care for the mandated vaccination for long-term care staff it came out in October with a deadline for November 15th. The announcement last week was really about hospital. It was a hospital focus, so healthcare workers in hospital, and the government has opted not to do the same mandate in hospitals as they have for long-term care. Having said that, many hospitals had already implemented the mandate and are continuing to do that. So, there has been lots of partnership over the past months in hospitals and long-term care and community healthcare partners coming together and aligning on strategies. It's what's best for the community. It's what's best for the patients, residents, family members, for the staff. And so there has been a lot of alignment, and there are very few hospitals that are not mandating vaccination for their staff.
Are pets allowed again in resident rooms for visits?
I don't know if you can tell that I'm looking at you, Dana.
Yeah. So again, it is one of these things. It is the pet. We have a pet policy. So is the pet vaccinated? Again, is the roommate allergic? But generally speaking, we'd love to see pets back in the home again. Just check in and making sure that there is that adequate vaccination, and the RFSMs are certainly your go-to to bring in pets. And we had some pets just the other day I was in and saw. It's a great spirit lifter to see pets in the home for sure.
That's great. And RFSN, that's Resident Family Services
Yes.
Manager in the homes? Okay, great.
That's right.
Have long-term care residents all had the booster shot? I'm guessing
Yeah,
that's COVID booster shot.
The COVID booster, everyone that has been eligible has been offered, and there's been a very high uptake in the third dose. And I say eligible, some of it has to do with timing.
Mhm.
So residents that are new in our homes that have newly moved in may have had their second vaccination when they were coming from hospital, or so the timing might be different. And so they might still be on the list waiting for the time to be right for their third dose.
And each of the care communities has a list, and we've ordered the vaccine and ready to go. So we're on the mark as soon as the timing is ready and the resident and family have the consent. We're probably going to be continuing to give these boosters into the new year. So just given the timing with the 5, well, it was 5, now it's 6 months in between the from the primary series to the booster, or the third dose rather, for our residents.
Dana, is there a difference between boosters and third dose shots? Are those two different things?
Yeah, I think the way that they've described it is that, in particular for our residents, what they're describing as a third dose is recognizing that this third dose essentially is what is needed. And with those that are elderly or with comorbidities, they've identified that needing 3 doses is certainly what is would be considered a primary series, whereas a booster is when you've got your primary series. And for those, you know, the healthcare workers, for example, who have no comorbidities or don't have any underlying conditions, they'll have their primary dose, and then their secondary dose. And then as they've identified that there's some waning of immunity, and then they'll boost it, very much like what we do with hepatitis B doses and other types of vaccines. They'll wane, they'll get a third dose, which is a boost, which just maintains that. So that's where you'll hear the third dose versus a booster. I hope that makes sense.
Yeah, that was great. So in general, a designated care partner would likely be getting a booster opposed to a third dose.
That's right. There is some other variables too as we're working through this with the booster. For those that, if they had Moderna, first and second shot Moderna, and they are under 70 years old, they'll get a half dose as a booster. Those over 70, so for some of our DCPs who are requesting the Moderna, they had that in their series. Over 70, it will be a full dose. So we're working through some of those logistics, and I know when DCPs come to sign up, whether they'll get their flu shot, some COVID, we're working on a sheet to try and collate that and do some timing, but there's a bit of logistics, but we're here to support anyone who wants both the flu shot, residents, staff, DCPs, as well as the COVID vaccine.
Okay.
Rob, it's so much information. Like it's overwhelming for us, and or I think it's overwhelming for everyone. I sort out we work to sort out the details. What does this mean for our residents and our DCPs? And then I think, oh, what about my in-laws? I wonder where they fit in this, and how will they know when to schedule an appointment? And then for people that have 5 to 11-year-olds, there's information coming out about that. So there is information overload. So
yeah,
please don't hesitate to check in if you have questions, because we have them too.
Perfect. And just to elaborate a little bit more, Dana, you used Moderna as an example a couple of times there, but is it similar with Pfizer as far as the half dose shots, do you know?
No, Pfizer will be a full 0.3. So 0.3 mil. That's what we give for Pfizer for the primary series, and that will be for the booster for adults. Yes.
Perfect. A question here about when the booster shots will be given. I think we have most of that for the homes, but maybe that's something better to circulate in an update email just so everyone has it in front of them. But do you have that right there, Jen?
Yeah, we're still working on the dates, so we will send those dates out by email, and we'll put some posters up in the home too. So as recent as this afternoon, we were just checking in with public health on supply, how much vaccine was available, so that we could start setting the dates, the clinic dates. So it's this news is hot off the press, so stay tuned.
Great, thank you. Can an unvaccinated designated care partner take their loved one out of the home for a drive?
Sorry, I froze up a little. Am I back?
Yep,
Yes.
you're back. Did you hear the
Okay.
question?
I can read. I can see it. So
Okay.
yes, most of the restrictions around residents going out have been lifted. So residents can go out with an unvaccinated or a vaccinated visitor or a DCP. They will still need to, yeah, they'll need to sign out, and I do encourage you to do a bit of a risk assessment. So check in with the nurse and to talk about where you're going and what you're doing. And, you know, if you're unvaccinated, really encourage mask use. And then Dana, you were going to.
I was just going to say that, Jen, and mask use and some other, as you talked about, with risk assessment, if appropriate, you know, we're still trying to physically distance in everything we do and wash our hands in everything we do, and you know, stay home if you're not feeling well. The same would go for that. And again, the car ride is, you know, getting out, and the colors, well, they're not so bright anymore, but getting out and looking around, it would be a real boost. So again, just risks, as you said. And ventilation is big. Ventilation is big in terms of the windows we can open. Again, whether we're gathering for family meals, we'll look to the room. How can we ventilate? Can we open up the windows, making sure, and again, the 3 W's go for every scenario we've talked about today, you know, wearing a mask, washing your hands, and watching your distance, whether we're visiting in the room, in an auditorium, and in a car. We'll do our best.
Do we know, will the boosters be mandatory for long-term care employees? And will the boosters be more effective in preventing transmissions? So you maybe want to take the first part of that, Jenna?
Yeah. Oh.
For me, Rob, sorry, did you say Dana?
No, Jen.
Oh,
yeah. So
Jen. Okay.
I'll start, and Dana can be thinking about the second part of the question in terms of transmission. So at this point, the ministry has indicated that fully vaccinated, the definition of that is the first 2 shots, 2 vaccines plus 14 days, and that definition won't change. So as of today, the booster, the 3rd dose for staff, is not mandatory. If that changes, I will make sure that we communicate that. But as of right now, it's not mandatory. We are encouraging it, and we're doing everything we can to make it available and easy for staff and DCPs to get their booster. But it isn't, and many people are already talking about doing it. So, but it isn't mandatory.
And Dana, do you have any insight about whether the boosters will be more effective in preventing transmission?
Well, you know, we're looking a lot at Israel in terms of some of this research and evidence, with taking a look at including the boosters, you know, and obviously our neighbors to the south have also been exploring it. We're not alone in looking at the boosters, but that is the intent. Again, you can see when your immunity wanes, and whether that be COVID or other vaccines, when that require a booster, the intent to boost is to build up that immunity. And what we do know is the evidence that those that are fully vaccinated tend to have less risk of transmission, lower viral loads, and if they are to be positive, there's a shorter time frame for which they can transmit the virus. So that's the intent of what we're doing. Even though we are seeing some cases for those that are vaccinated that are becoming positive with COVID, we're seeing less severity, shorter illness timeframes, and less transmissibility of the virus. So I think boosters are certainly our way to support and build that immunity. And I think we just look to what the data shows in our long-term care homes. Provincially, there are only 2 long-term care homes that are in outbreak. Of those 2 care homes, the transmission has stopped, and when we look to the booster doses for third doses for our residents, the data is definitely demonstrating that it is a protective factor, and vaccines and Ipac measures are the way to support us. Infection prevention and control, Ipac, are the way to get us out of this.
Great, I think that was a really good response, Dana. Thank you. Okay, so another question regarding residents out of the home. So if a resident is taken out of the home, do they have freedom when they come back to long-term care to go to the dining room and other activities as usual, or do they have to isolate in a room for a period of time?
Freedom. So yeah, freedom. The only time that any resident would need to isolate is if they are exhibiting symptoms. And that is really like the old days, which is kind of nice. So that's not new. It's just something we talk about more. So if somebody has symptoms, sore throat, cough, runny nose, vomiting, diarrhea, those kinds of things, then they don't really feel like going out anyway, and they would be staying in their room to get better and to prevent any further spread. So they have freedom. It's so nice. I can't believe we're at the almost 2 year mark, and I just think about how far we've come in these strategies and the discussions that when 2 years ago to now. So it's I'm so excited to be able to answer that question with freedom.
Will there be any bus tours for residents to see the Festival of Northern Lights?
That is a great question, and I do think that I read the program managers, the resident family service managers, send me an update ahead of these calls so that I can be prepared. And I know that one of the homes hasn't been able to book a bus, and I don't know the details on why that is, but I know there'll be lots of good reasons. And so they're looking at doing a transformation of their auditorium to a winter wonderland. So stay tuned for that. So they've just sent me a quick message. They're not able to book buses in the evening, and that's out of Rockwood. So I'm not sure if the Manor and Grey Gables are facing the same challenge, but I'll do some follow up and look into that. I'm guessing, but there is a shortage of bus drivers for schools, and it's quite possible that that might be part of the challenge. I don't know that for sure. I'm just guessing.
All right, thank you. What is the best way to have Christmas gifts of clothing labeled by the home? Might be more specific than we can get into here, but
no, there is a process in each home, and I imagine it's fairly similar. But when you bring in clothes for your person outside of Christmas, bring it in a bag, or the home will give you a bag that the person's name can be put on, the resident's name. Leave it with the nurse, and they'll make sure that it gets to the laundry and the label is applied. There is usually a specific process for Christmas that is often highlighted in the newsletter, because I know Christmas gifts come wrapped, right? So they can't be labeled. leave that with me. We're going to put it on the list of items to follow up. And when we do the follow-up email, we'll just put a little note about the details on that in the follow-up email.
All right, perfect. So that does empty the questions that I'm seeing in the Q&A here. We do still have a few minutes, so if anyone has those, please do enter them into the Q&A and we can still try to get to those. I do see one that was sent in the chat here, Jennifer, regarding the outcome, I guess, of staff vaccination, regarding liability and what compensation would be for an employee who is forced to get the vaccine in order to keep their job and subsequently suffers a vaccine injury, which disables them from working. So I think there's a lot of assumptions in that that question there, and I wonder, can Dana or Jennifer, can you speak to the risks associated with vaccination, and do we have any statistics on that at our fingertips tonight?
So maybe, well, and Dana might be able to just speak right off the top of her head. I will say that you know, a mandate feels a lot like choices being taken away. However, we have had a very lengthy process and very engaged process in terms of connecting with people to talk about their hesitancy, to, without judgment, the reasons of their concern, link people with the appropriate experts to help answer those questions, support people in the process for reviewing a medical exemption and whether or not they're eligible and what that looks like, and really supporting people to the best decision for them. So, you know, that's really important to us, that people feel that they've had an opportunity to ask those questions and work through that process. In terms of risks, Dana, did you want to comment on that?
Yeah, and in terms of what we're taking a look at risk, but and I was just trying to find what Dr. Kieran Moore, who's our Chief Medical Officer of Health for the province, and I can't find it at my fingertips, but what he did describe is that in terms of true adverse events for this vaccine, he would suspect that it would be for a population of 100,000 people. In terms of those who truly would have an adverse event or that would exclude them from taking the vaccine, it's 1 to 10 out of 100,000. So we're really looking at a very small proportion of the population that would have what is described there as a vaccine injury. And we've been really fortunate that many of our staff have had the conversation with us of their concerns. We've done lots of face-to-face conversation. We've worked with their healthcare providers and have followed through a process that I think is really respectful for where they're at and respecting their health and well-being, because certainly we're part of this community and we want to do what's right, not only for the residents, but for the staff that support the work that we do. So I really think, again, just it's low for a vaccine injury as described, and quite incredibly low. So in the Graybers population, medical exemptions, we wouldn't expect probably more than 10 to 15 based on Dr. Kieran Moore's messaging, but we definitely want to support those people that are part of our care community.
All right, thank you very much, Dana. And I think that to anyone trying to educate themselves on vaccine safety and everything, like, I don't think we can stress enough the importance of seeking out trustworthy and reliable information. And the best way to do that is through your medical practitioner, your family doctor, if you do have very specific questions. So yes, really, please do check the authenticity of all of the information that you're receiving, because there is a lot circulating out there.
In the follow-up, Rob, we could also share some links to resources. The Scarborough Health Network or Health System has a dedicated team to support healthcare workers, specifically long-term care, paramedics, hospital, who have, or maybe it's even anyone in the province who has questions about these exact questions and who have hesitancy and have concerns. And they are specialists in that field and they're available really easily. And there's 2 or 3 different ways that a person could connect with them. Email, Teams or Zoom type connection, telephone. So we can include that link as a resource in the follow-up newsletter.
Great idea. I don't see any more questions. I do see a comment though. Soggy Mobility has changed their hours. Monday to Friday buses run until 6. Saturday buses stop at 5. So that is maybe one of the challenges that we're running into at Rockwood Terrace. So
yeah, and it's actually all 3 leaders have connected with me. What did we do before these things? But they've all connected and confirmed that that is the challenge. And like many organizations, it's a human resources shortage that is impacting service. So we're being creative and finding other ways to bring the Festival of Lights to the homes. In fact, last year, I think they did like a drone tour, so we can connect with them and see if they're doing that again.
Very cool. All right, I think we're slowing down, so we'll take one more question here, and then I think we'll maybe call it for this evening. Sure. If unvaccinated staff are unable for medical reasons to get a vaccine, are they able to take short-term or long-term medical leave rather than facing a suspension?
Yeah, and that's a great question. Thanks, Janice, for asking that because we didn't really get into those details. So an approved medical exemption, an individual with an approved medical exemption is able to continue working and they are just required to rapid test 2 to 3 times a week. So they wouldn't need to be required to take a leave at all. If in fact it was a short-term medical thing and they needed to be off for a short term, we have those options available for staff to take protected medical leaves.
Perfect. Thank you very much for clarifying that. And that is the last question that I see. So thank you everyone for joining us tonight on the call. It's nice to see everyone again. Jennifer, did you have anything to close with tonight?
I do. I just want to thank everyone again for your questions and your engagement. It really helps us make sure we're on the right track. And I believe that we have lots of reason to be hopeful. It does feel like the pandemic is dragging on and when will it ever be over? But we have lots of reasons for hope. The investment that the province is making in improving the resident experience, which will also improve the team member experience, which will overall improve the whole home experience, is really hopeful. And this investment in person-centered philosophy, with our Color It Your Way philosophy, we already have a solid foundation to really make positive and impactful change. So there's a lot to be hopeful for, and I look forward to those updates and those conversations about what that looks like. So be prepared. We're going to be asking those questions. What does an improved, enhanced experience look like from your perspective? And we're going to be asking the residents too, and the staff. We want to make sure that this investment is money well spent and is an improved resident experience. So stay tuned for that. Thank you, and we'll see you again soon.
Good night, everyone.